So thank you so much for having us today. May is Lupus Awareness Month, and we're very excited to be able to have this opportunity to speak with you. I'm going to just go through a couple of housekeeping items. If you all see, there's a chat feature. We're going to be using the chat feature, not the Q&A. So if you do have any questions, please put them in the chat box. Alicia will be monitoring it. I think she's already put a welcome in there. We encourage you to interact, and if anything, you have questions, we commit to answering what we can today, and if not, we'll capture them and get the information back to Rory so she can share that. Everybody's muted, so that's great. If you want to alter your view, you have the options of setting your own view, so there's a view button. Most people should have it somewhere near the top of your screen. Sometimes you'll have it on the bottom. But if you want to get a better view of the slides, that's up to you to set it. And then Rory is recording today's program, so the link will be available to be shared. So the Lupus Foundation of America has a vision of a life free from lupus, and our mission is to improve the quality of life for all people affected by lupus through programs of research, education, support, and advocacy. We're going to talk a little bit about what lupus is. It's hidden, unpredictable, undefined, and misunderstood. It strikes without warning, and it can affect any part of the body. It can range from something mild, like a skin rash, to something very severe, like a heart attack or kidney disease. There are no known causes and no known cures for lupus. So who gets lupus? We estimate that 1.5 million Americans have lupus. 90% of them are women. 15% are diagnosed as children, and children tend to be have much more severe disease activity than adults. It is 2 to 3 times more prevalent among people of color. And in that group, we include Black, Latinx, Pacific Islanders, and Native American people. Most people are diagnosed between the ages of 15 to 44. And so since we talked about that this is 90% women, this is certainly in prime childbearing ages. So fertility is a very big concern for people living with lupus. 10% of people will have more than one connective tissue disease. And then in terms of the genetics of the disease, 20% will have a parent or sibling with lupus, but about 40% have a relative with another autoimmune condition. So we definitely suspect there are genetic predispositions to lupus, and that's something that we're continuing to research. Since I said earlier that lupus can affect any organ of the body, it can be very challenging to diagnose and treat. So if you think about when you're not feeling well, if you had a sore throat or an ear infection, you'd probably go to an ENT. If you had a rash, you'd probably go to a dermatologist. If you had heart issues, you'd probably go to a cardiologist. And so they're seeing one aspect of your disease. So people go to treat the symptom that is most prevalent for them. But many times it can take up to 6 years and 5 doctors to get the more comprehensive view that this is not an isolated dermatological condition or cardiac condition or nephrology. It's all encompassing in lupus. On average, people with lupus take nearly 8 medications a day. It's a leading cause of death in young women, but often goes unreported. And the reason for that is when someone passes away, they pass away from a cardiac issue, kidney issue, something, again, an aspect of the disease. But I had a mom call me when her daughter passed away several months later, and she was fighting with the coroner because she wanted the cause of death to be reported as lupus, and they refused to do it. So we actually don't have really great statistics on that because we know that it is underreported. 40% of patients reporting a severe flare were admitted to a hospital at least once during the past 12 months, and the average stay was 10.5 days. And a flare is a state of heightened disease activity. So people with lupus can be managing their lupus, and then really out of nowhere, a flare can start to happen where their disease activity increases, sometimes to the point where people either can't get out of bed or are hospitalized. And there are many triggers for flares, including stress, exposure to the sun, all kinds of things that can make a flare, exacerbate a flare in people. Lupus really can affect every facet of your life. One of the things we hear a lot from our lupus warriors, as we refer to them, is people saying to them, but you don't look sick. Other than the rash across the face, the butterfly rash, which is something that people are familiar with as a sign of lupus, for many people, they don't have any outward signs or manifestations. And so let's say a person with lupus was experiencing extreme fatigue and was on public transportation and took a handicap seat. They might endure a lot of, stares or worse from other people on the public transportation, because they're thinking, well, who are you? You look young and healthy to me. Why are you taking that seat? So there's the stress of sort of the misunderstanding and lack of knowledge about it. It can affect people's work life, their daily responsibilities, fertility we talked about, relationships. Sadly, we hear from a lot of lupus warriors that they have stress in their own lives with people in their own families and friends, particularly in this age of social media. Somebody might post a picture, and not during the pandemic, but earlier than the pandemic, and maybe coming out of the pandemic, on a Thursday night where they're out, socializing with friends. And then on a Saturday, they might have a family party that they don't go to because they really just can't get out of bed that day. And they get stress from family members who are like, oh, I saw you out on Thursday night. Why couldn't you come today? And so there's sort of a lack of acceptance of the person living with the disease really being the authority on when she feels great or doesn't, feel up to it. Financial burdens of living with lupus, the medications, the many doctors, the many treatments. Some people are not able to work because of their lupus. So again, it really can affect every aspect of people's lives. So what are we doing at LFA to address lupus? We have 3 primary areas that we focus on: research, care and support services, and advocacy. And Alicia, just wave or something if anybody's got a question that you need me to answer. So we have 3 primary strategic objectives. The first one is reducing the time to diagnosis. And I said a little bit earlier that, why it takes so long. So part of what we're trying to do is educate people about the signs and symptoms so that when they're talking to their medical practitioner, they can be asking good questions to help maybe empower themselves and advocate for themselves to get tested. We also are working within the pharmaceutical and medical community to find new ways to reduce the time. We want to ensure that people with lupus have a safe and effective arsenal of treatments. And what do I mean by that? Well, in the last 45 years, there have only been 2 on-label drugs for lupus, and the second one only came this past December. So that's really unacceptable. People with lupus take about 8 medications, so that may be confusing to people, but they take a lot of off-label medications that are not intended specifically for lupus. And so part of the challenge is to have a drug approved. You go through a clinical trial and you take a group of people, you put them through a clinical trial, and then you see what the results are. But lupus is a disease that everybody's symptoms are different. We talk about the heterogeneity of it. So if I had 50 people who had lupus, they have 50 different starting point, 50 different experiences. So how do you put them through a clinical trial to measure whether a drug has impact or not? So we have worked on what we refer to as patient-focused drug development. We've worked with patients, with the pharmaceutical community, with government agencies to talk about how do we do clinical trials so that we can have more resources for people with lupus. one of the big medications people with lupus take are steroids. And for anyone who's had to take steroids for any lengthy period of time, you know, sometimes the cure is worse than what you were dealing with before. There's all kinds of bad side effects. So even looking at how steroids are delivered to people and are there safer ways with less side effects. So that's a big focus. And then expanding the services and increase access to treatment and care. You know, obviously one of the big topics in, thankfully, these days is parity in healthcare treatment to everybody. And so, you know, making sure that we are reaching out in all communities and delivering health services where people need them. So that's another area that we're involved in. And to do all that, our fourth objective is raising the money to be able to do that. In terms of our research, we really are trying to attack research in a multitude of ways to make sure that we are, you know, leaving no stone unturned and trying to find resources for people. We talked about drug development. We have a stem cell research project that we're funding right now. Dr. Gary Gilkison from the University of South Carolina was the primary person involved in that, but there are multiple sites across the country. It's been a little bit hampered by the pandemic because part of it is inpatient visits and testing. But if we are able to find ways that people can use their own stem cells to treat their lupus, these are mesenchymal stem cells. They are not umbilical stem cells. So these, this is something that we are hoping will show some great results in the next couple of years. A big part of lupus is lupus nephritis, which affects the kidneys. So we're working to have a real-time test to assess kidney function so that we can see when people are starting to have kidney issues earlier so that they can be working with their medical team in advance of their kidneys really stopping functioning. We had the first National Childhood Lupus Research Program, and I mentioned earlier that children generally have a much more severe case of lupus, so it's really important that we understand why that is. And we work in partnership with an organization called CARA, which is the leading pediatric lupus organization, so definitely a priority to look at that. And then just really working to drive all the breakthroughs in the understanding of lupus. So lots of different ways that we are approaching it. We've recently introduced RAY, Lupus Research Accelerated by You. And this is a patient-powered research tool where patients can go in and they can log all of their information, they can track their symptoms, and they can provide information that researchers can use voluntarily and to help us have a better understanding. You know, the patient voice is so important and really being partners in healthcare and understanding and listening to the patient. So RAY is a great way that we can do that. So in terms of support resources and community, we have the expert series. We have a podcast that comes out once a month, but they're all stored online so you can listen to them at any time, where leaders across the country will speak on a particular topic. And they're great programs to listen to. So if you're looking for particular information, you can search our expert series and see who's presented on it. We have in-person support groups. And then we have Lupus Connect, which is our online community of support. Currently has over 16,000 members. It's a great resource. It's available 24/7. I find it to be a very warm and welcoming environment for people. It's policed from the point of view for bad behavior. So if people are not being good, they can get removed from the site. But a lot of times it's just warriors asking warriors questions, or just really, you know, looking to share some feelings they're having that day to people who are understanding what they're going through. Our National Resource Center on Lupus is a great source of information. It has articles, videos, all kinds of content. It There's the ability for it to be curated for you. So for example, if you went in and typed in, I'm newly diagnosed, it would present a series of articles and videos for the newly diagnosed. If you said, I'm a caregiver, there'd be a series of information for caregivers. If you were interested in fertility issues, if you were a parent of a child with lupus, concerned about school issues, all kinds of information in there, and it's being updated all the time. And I like to say what I feel are kind of the crown jewel of our organization are our wonderful health education specialists. They're available to give information to you in English and Spanish. And they have one-on-one calls, and they can help with a number of topics and provide resources. We have Take Charge, which is a 12-week email series. One of the things when you get diagnosed with lupus, what we've heard from patients is, in addition to the physical and emotional part of it, you're entering kind of a new world of terminology. People are talking about tests you have to go have, doctors you have to go see. There's numbers thrown at you and levels of this and that. So it's hard to navigate all that new information. So we really want patients to feel empowered that they have the information they need to help manage their disease. We have a program called Be Fierce, Take Control. And this is really focused on 18 to 25-year-old young women. Again, in the quest to have faster time to diagnosis by sharing information about what lupus might be. Could it be lupus? Overview, what are some of the symptoms? We share this on social media, and the target audience for this is, again, 18 to 25 Black and Latina women. And so we've been very successful with this campaign and getting a lot of information out there. So I've talked a lot about lupus, but I think, it's always best to hear from somebody who's been on the journey herself. Alicia is not only, in addition to being my wonderful colleague, she is also a woman living with lupus. She was diagnosed in 2014, and she was fortunate in that a competent team of doctors were able to diagnose her quickly, which unfortunately is not the norm. Her supportive village includes her adult daughter, teenage son, and she manages her lupus with their help as well as medication. And Alicia is a firm believer that a positive outlook on life, we call her Positive Patty, truly provides the ability to cope with such a devastating illness. She's very vocal about her journey and hopes that being transparent will be an encouragement to others living with lupus. So with that, I'm going to turn it over to Alicia.
Hello, everyone. So Sue said, my name is Alicia. I do work for the Lupus Foundation. I've been with the foundation for about a year now. I started off as a team captain for the Boston Walk and then transitioned to Hartford. So I went all the way from a volunteer to a part-time employee to now a full-time employee. So it's been a great journey. When asked to speak about, my journey with lupus, sometimes I'm a little wary because in comparison to others, but I've had to stop comparing myself because, as Sue said, no two stories are alike. I always feel that mine is on the more moderate side, and it is, but I think it's also important for people to know that there are very severe cases and there are those that are not as severe. So there's a wide range. So back in 2014, around January, I started not to feel very well. Called my primary. I was tired, very tired. I lost a lot of weight. I honestly didn't think anything was really wrong. I thought I was a little run down. My boss at work at the time had gone out on medical leave unexpectedly, and I was in a new position. So just running around, trying to learn my position, her position. I was in the office alone. I thought it was stress, but I did go to my primary, and he ran tons of lab tests, and he called me and said he wanted to send me to a hematologist. And he didn't tell me why. He just said, I saw some concerning things on your lab reports, and I want you to go see a hematologist. And I said, okay. So they referred me to someone at St. Francis Hospital in Hartford. And I went. So from January, I went to the doctor. I wasn't feeling well in January, went to the doctor in April. I didn't get the appointment with the hematologist until early July. So, there were a couple months where I still wasn't feeling well. Went to see Dr. Borakov in July, and he initially thought that I had sickle cell. So he ran some more tests, and then he said, I actually think you have an autoimmune condition called Sjogren's syndrome. And I was like, really? I've never heard of it. So, he gave me some background on it. Sjogren's is also an autoimmune disease, and a lot of people that are diagnosed with lupus oftentimes are diagnosed with other autoimmune conditions or mixed connective tissue disorders. So I have Sjogren's as well as lupus, the systemic lupus. So, so he then referred me to a rheumatologist so that she could confirm, his assumption and go from there. So I went to my doctor, Dr. Terlicio, and she confirmed that I did have Sjogren's and lupus, and then started me on a course of treatment. Now, let me go back to what Sue said, that the typical time for diagnosis at times is up to 6 years. My situation is completely different from most. I knew within a month what was going on with me, and they were able to start taking action, which is almost unheard of. But I feel that, I just had a great team. That's why I call them a competent team. And I'm still followed by the same doctors. I've never had to change physicians. I'm still followed by a hematologist and my rheumatologist. And so they started me on medication. So immediately I had to start on prednisone, which Sue said is a steroid. I was on prednisone for 2 years. Prednisone is supposed to be a taper drug. You take it for a short amount of time, you taper off of it. But it's a very effective drug when fighting the disease. So in my case, it made my lab work look wonderful. It made me feel terrible. I gained tons of weight. Prednisone oftentimes breaks your skin out. My face was in shambles. I had open sores on my face. I had a headache for 2 years straight, every single day of my life on that medication. But I stayed on it because we were trying to figure out. So along with the prednisone, I was on hydroxychloroquine for that length of time. I'm sure everyone's heard that medication name from last year, where there was a shortage of it, which was a huge problem for lupus patients. And the foundation had to advocate with Congress to have an emergency supply authorized in order to get lupus patients their medication, because a lot of lupus patients, I'm no longer on that medication, but that is one of the main maintenance medications used for lupus patients. So that medication did work at the time. It stopped working years later, but at the time that worked. Then I tried methotrexate, Actar gel, Imuran, nothing worked. Everything, I had a reaction to everything. So that's one of my plights with my condition, is my doctors haven't been able to find a combination of drugs to properly manage it. But I am on other medications for hypothyroidism, which is another condition that's exacerbated by my lupus. So I take levothyroxine for that, and that's managed. I have high blood pressure, so I take a medication to manage that. I have severe anemia, so I've had several blood transfusions over the years. I've had to have iron infusions. So it's quite the journey. It's quite the journey. I'm no longer on any maintenance medications right now for lupus. My doctor does want me to try something because, believe it or not, I'm going through a flare right now. So when Sue was going through, people say, oh, you don't look sick and that type of thing. We don't often look sick. I don't think I'm not sure. I don't think I present as looking sick today, but I actually am. I actually have not been feeling well since about March 1st now. And I went on prednisone taper because that normally resolves it. It did not work this time. And I've just chosen right now to kind of just go through it because I don't want to try any new medications at the moment. And that my medical team works with me in terms of what I want to do. If a medication only makes me feel sick and it's not doing anything, I'd rather just wait it out. And as long as I'm still able to move about how I'm able to move about, then I'm fine. Another thing I did want to mention is, Sue touched on, family and friends maybe not understanding what we're going through. That's a huge, I've gone through that, and that's a huge thing. I've lost friends. Um, you know, Relationships are often tough when you have a chronic illness. People don't get it. They don't understand it. Fatigue is huge. And Sue says she wishes that there was another word to replace fatigue, because when people hear fatigue, they think, oh, well, go lie down, go take a nap, and in an hour you're fine. No, that's not the way it works. That's not the way it works at all. I could literally be fine sitting here speaking with you right now, and in 5 minutes it will be like my body will shut down and I can't do anything. Maybe for the rest of the day I have to go get in my bed, and that's it. And there's something lupus patients, we try to explain our condition with something called the spoon theory. And basically what it is, and I use it and my friends now get it, then they'll say, oh, you don't have any spoons. So with the spoon theory is basically you wake up with a certain amount of spoons to use. And as you go through your day, you use a spoon for this or 2 spoons for that, and so on and so forth. And the concept is that once a lupus patient is out of spoons, if I have 10 spoons and by 6 in the evening, I've used 10, I'm done. I can't do anything else. Again, speaking to what Sue said about someone may see a picture and I'm out having a great time on a Thursday night, and Friday I'm done. I can't do anything else. And, people have doubted me being sick. People have questioned it. People have thought I've been lying about not wanting to do certain things, or I've been very surprised at the things people have said about me to me, and just been very doubtful because I don't outwardly wear illness. I always try to be jovial, because I feel that if I'm not, that's not going to make me feel any better. So I want to laugh, I want to smile, I want to share, I want to encourage, empower, that type of thing. But yeah, that's my story. So I live with it, but I don't let it overpower me. I try not to let it dictate. Sometimes it dictates. And in those instances, I can't help it. But it is possible to live a full life with lupus, and still be okay. And I'm okay. And as long as I'm still here, I'm okay. And I love working for the Lupus Foundation. It's like a dream to be able to work for an organization that supports my condition. So that's that. We did have a question in the chat though, Sue. How likely is it? Hi, David. David said, how likely is it for a moderate case to change to a more severe one, Sue?
That's a great question. And sadly, it's over, as Alicia said, a chronic condition. So there are people that go literally years without any disease activity or very mild disease activity, and then can have a flare that exacerbates their condition, and then other issues come up. The most common issue that people have are kidney disease, lupus nephritis. And so there are people that have, again, fairly mild case, and then they have kidney involvement. And when they have kidney involvement, it just becomes very serious, very fast. So it's unpredictable. That's one, we call it the cruel mystery, because there's so much that we don't know about it. I've actually heard celebrities who shall remain nameless say that they're cured from their lupus. And we don't really know of our rheumatologists and our medical board don't talk in terms of a cure right now. It may be that their disease activity is very mild, but it can come back at any point. And so, you know, it's great if somebody's feeling wonderful. That's the goal. That's what we want. We want people to be feeling great. But, you know, I know people that have had very severe issues as children, and it's gotten milder in adulthood and vice versa. So I don't have a hard answer for you, unfortunately, but it's a lifelong condition right now. And the challenge of it is, you know, just makes it so hard not knowing what's around the corner. So obviously we want to invite everyone to help us with our mission. And so here are some ways that you can get engaged with us. We have the Walk to End Lupus Now, as Alicia mentioned. When we are in person, we have physical sites in Hartford at Rentschler Field and in Norwalk at the beach that starts with a C. Why am I forgetting the name of the beach? Alicia to help me out, but and so this year it is virtual, so people can participate from coast to coast. And if you have an interest in getting involved, you can contact Alicia. It's a wonderful day of support. You can pick a place to walk with your family and friends near you, in a park, on a street, whatever you want to do. But you can get involved early. We have a lot of people signing their teams up now for Lupus Awareness Month. There's a special incentive going on right now that if you register before the end of the month and raise $50, you get some really fun Gooder sunglasses. They're polarized, they're award-winning, cool purple sunglasses. So if you want more information about that, you can ask Alicia.
So is it Calf Pasture Beach?
Calf Pasture Beach, thank you. We have another site in Hudson Valley called Chadwick Lake Park, and for some reason that was stuck in my head, so thank you.
Thanks, Rory.
So we advocate on a federal and on a local level, and so we go to the federal government. Many of you may know this already, but the federal government is one of the largest funders of all kinds of medical research. So every year we go down to DC. For the last 2 years, it's been virtual. And we have what we call Hill Day. And we meet with members of Congress and senators. And we talk to them about the importance of funding lupus initiatives. There are 4 primary budget items where we ask for it: the National Institutes of Health, the CDC, Center for Disease Control, the Office of Minority Health, and the Department of Defense. They all have line items for research. And so we have stimulated over $630 million for research. That does not come to us at the LFA. That is money that becomes available for researchers throughout the country to apply for grants for the projects that they're working on. We also have the opportunity to advocate with our legislators when they're in their home district. So we'll reach out to people and ask if they want to set up a Zoom meeting. Again, right now it's all virtual. A lot of times you're talking to the staff person. They usually have a health policy person, but sometimes you'll actually meet with the elected official. And then from time to time, if you register as an advocate, if there's an issue out there, we'll just ask you to email. There's a whole system online where you register and you'll get an email asking if you want to send an email to your congressional representative or your senator. We also do some legislating on the state level when state level issues come up. So that's another way that people can support us, by joining as an advocate. We talked about May being Lupus Awareness Month. So this is a great opportunity to raise awareness about lupus. We have a lot of resources, particularly if you're on social media, you'll see a lot of information. This week in particular has a focus on mental health and lupus. And so we have a different theme each week. May 10th was World Lupus Day, and we had people participate from all over the globe. And May 21st, which is a week from today, is Put on Purple Day. So on that day, we encourage people to put on some purple, take photos, share them with us. You can email them to us, or you can post them on social media and tag us, and I'll share that information in a minute. but we really want to flood the internet with lots and lots of people in purple to help raise awareness for lupus. This is some of our contact information where you can get more information about us. Website, phone number, email, our Facebook, and our Instagram. And with that, that's really the formal presentation, but if you have questions, Alicia and I would love to answer them.
Okay, David says, you mentioned fertility issue complications. Can you expand on that, please?
Yeah, so when disease activity is high, there are concerns about women's ability to either get pregnant or to maintain their pregnancy through delivery. I can tell you a quasi-personal story of somebody I know. I started with the Lupus Foundation. It'll be 6 years in September. And that December, I got a holiday card with one of those, letters in it that people put. And this is a friend of mine's that actually my prom date's parents sent me the letter. And she mentioned that her granddaughter, Olivia, had been diagnosed with lupus. And fast forward to a graduation party about 1.5 years later, she told me that Olivia had been told by her doctor that she would never have children. And, I said, gee, Elaine, that's not necessarily the case. She really should go and talk to somebody else. And, fast forward, here we are 3 years later. Olivia has a 2-year-old, happy, healthy baby. I was on a call earlier today with a woman who has lupus who had a preemie, and her baby was born at 1.8 pounds and actually lost weight, was in the hospital for 3 months. He's graduating from college this year, James, so that's a wonderful story. But having the proper care, if you're interested in, having a child, making sure you're talking to your practitioner. A lot of times a lupus patient will be automatically assigned to a high risk category just so that they can maintain their pregnancy and, make sure they're working and, dealing with their lupus at the same time. But the fertility rate for people with lupus is getting better all the time. And there are great doctors, and we're very fortunate in this part of the country that there are some of the best doctors in the country who are dealing with fertility and lupus. And if you want more specific information, I can send you some links to some of the work that's being done.
We don't have any more questions. Are there any more questions? David says, thank you.
And if not, we can turn it back over to Rory, and just thank you so much, Rory, for setting this up and giving us this opportunity. And we really appreciate it.
Yes, thank you so much for being here. People have been asking for this, so we really appreciate that. If anyone has any other questions, I'll put my email in the chat, or you can call me at the library. I'll let these ladies know and see if we can get those answered for you. And thank you all for coming. Alicia and Sue, it was so lovely to meet you, and thank you so much for all the information. So let me just put this here real quick, and have a great day, everybody.
Thank you. Have a great weekend.
Thank you.